Welcome to Light Body Radio, where science meets soul and healing gets multidimensional. I am your host, Dr. Lara May, functional medicine pharmacist, master intuitive Reiki channel, and certified life and health coach. Here we decode root causes, transmute stuck energy, and empower your full spectrum healing journey, body, mind, and light body. This isn't just wellness, it's awakening, grounded in science, guided by spirit, and designed for your evolution. Let's rise and radiate. Welcome to the next level of you. Hello and welcome to Light Body Radio. I am your host, Dr. Lara May, and today we have with us Heather the Hygienist. Heather has been a certified biological dental hygienist and a certified registered dental hygienist and an orofacial myofunctional therapist for 30 years, with 30 years experience in the field. She grew up on farms in Minnesota and Wisconsin, but moved to Florida in the 80s. Her parents were hippies and loved all things natural, so that's how she started on her path to wellness. And so it was when she decided to pursue after one of her twin daughters had serious health problems, including food allergies. So welcome. I am going to let you tell the audience the rest of your story because I find that's a lot more exciting than me just reading your bio.
Well, thank you so much for having me, Dr. Lara. I really appreciate it. This is a topic that, like you said, is something that really is kind of not discussed. So I'm so happy to be here and kind of share my journey as to how I ended up where I'm at. It was really after, like you just read, my twin daughters. One of my little girls was just extremely allergic to so many different foods, and I had to learn how to read a label. So I was actually shocked at some of the ingredients in food, like how on earth can we be eating petroleum products? And that kind of transcended into looking into oral care products. And I want to say 2010, in dental hygiene school, I'm not sure what kind of, schooling you had to go through, but for me, it was the whole conventional dentistry where everything is, fluoride and how wonderful that is. And anyone who disagrees with fluoride is a conspiracy theorist. So I never even questioned the ingredients in oral care products. But then I realized that the reason that they can put toxic chemicals inside of oral care products, and a lot of people don't know this, is because oral care falls into the same category as cosmetics. So when you look at some of these ingredients like poloxamer 407, which is an endocrine disruptor, and sodium saccharin is a known carcinogen, and these dyes that they put in there, alcohol even, which disrupts your oral microbiome and has a 27, it's so high, it's 27% alcohol that it can actually cause cancer, cancer of the throat, cancer of the mouth. So I was just really on a journey to find products that I could feel comfortable recommending to my patients. And I went to the health food store. I looked at every single product that they had. And there again, I was actually shocked to see some of these same ingredients in your health food stores. So I really just wanted to create something that was all natural, clean and green, but also safe and effective. So that's how I ended up creating Simply Silver mouthwash. And I've also written a few books, and I'm just passionate about teaching people how true health really starts with the mouth, and that's really not something that should be neglected.
Yes, so you've created Simply Silver mouthwash, toothpaste, and breath spray, and you are the author of Dentistry Made Easy, The Consumer's Guide to Oral Health and Smart Choices, and children's books too. So I love this cute little title, Dorothy and the Tale of the Lost Tooth.
Yes. So and I actually just released my latest book. It's called The Great Tooth Deception, Revealing the Dark Side of Dentistry. So that literally just came out 3 days ago.
Wow, congratulations.
Yeah, I'll probably never find another job with that book out on the market, but that's okay.
I think the tides are turning, so we'll definitely throw a link to all of your products and especially the new book on our show notes page. So don't worry.
Great.
So Yeah, and I agree with you. Like in pharmacy school and medical school and dental school and like hygienist school,
Yes.
it's very much funded by
Yep.
big pharma and big
Absolutely.
food. And so I've started to use the word indoctrinated because
Yes.
it
Excellent word.
really is it's these mantras and this storyline and all this propaganda that we're just told to know and understand and be able to regurgitate and not
Yep.
question.
Don't
And if
question.
and if you do question, then you get things like, well, there's no evidence to support certain
Yeah.
things, you're a conspiracy theorist, or all these other things. And now, of course, like the independent practitioners like you and myself and so many more out there, we have done our research. We know that there's plenty of evidence to support these other types of therapies and or how toxic and bad for you the quote unquote traditional way is. And so I just want to definitely like lead some light to that
Yeah,
because
you're absolutely right.
yeah. So let's get into the nitty gritty of let's start with the oral system and our health connection. So let's just start with the basic biology for people to understand because I don't think people really think about the mouth as being
No,
number one, like the first, well, your teeth really being the first step to your digestive tract. So
absolutely. Yeah,
so
exactly.
I'll let you go from there, but
Well, and that's the thing. I feel like there is this huge chasm between just regular medicine and dentistry, whereas the mouth is like some sort of a separate compartment. But you have one tube. It starts in your mouth and it goes all the way out to you. So digestion, everything starts right here. Your teeth are actually organs. They are linked to organs. So, there's meridian charts. I'm sure you are extremely familiar with that, how if there is sometimes a correlation with a health issue to the teeth, especially, with root canals and mercury fillings and all of these things. So the mouth is really it's a mini immune system. So you have 800 different bacteria, both good and bad, called your oral microbiome. And pretty much everything on the commercial market disrupts that. And it actually makes everything worse. It creates dysbiosis of the mouth instead of really increasing the immunity. Because again, we have to think of our body as everything is connected and not separate. So underneath your tongue is the most vascular part of your whole body. That's why nitroglycerin tablets work. If you're a heart patient, you stick that nitroglycerin tablet underneath your tongue. It bypasses your GI tract and goes directly to your heart. Well, guess what? So does that bacteria in your mouth. It can clog arteries. In fact, now we have testing, which I love, and I wish every dentist would do it, where we can culture the bacteria in the mouth and send it to the lab. And then the lab shows us the report out of the 11 bacteria that cause gum disease. If someone has 1, 2, or all 11, so we know how to treat it, because the root cause of disease, whether it be dental decay, which is the #1 disease in the world, or periodontal disease, the root cause is rarely ever addressed. And so people will, continue to go down this path until they end up having to amputate all their teeth, because maybe they did go to the dentist. Maybe, 100 million Americans don't go to the dentist every year, nor do they brush their teeth twice a day. But, you have this, unfortunately, this pattern of tooth loss. And it, if you end up in dentures, your lifespan actually decreases by 10 years. That's pretty significant. So catching that bacteria, dealing with the root causes, understanding how disease starts to begin with, how to support your oral microbiome, how to boost your immunity. These are all things that, can empower people to make better decisions, better choices, so that they don't find themselves sitting in a dental chair going, okay, what am I going to do? I'm faced with a $50,000 or $60,000 treatment plan.
Oh, for sure. And and you alluded to it a little bit, but when you said, if you end up in dentures, your lifespan is decreased by 10 years, which, wow, I don't think even in pharmacy school we heard that. Like, we hear about the statistic, like once you break your hip, after a certain age, then your lifespan decreases by 50%, and or your life expectancy is usually about 10 years after that, depending on how old you are. But yeah, the dentures thing, like, I've never heard that before. That's crazy. And two, like, let's get specific with the conditions that it can lead to: heart disease, diabetes, autoimmune disorders, which our country is riddled with right now. And then the other thing too that I don't think people realize, like, it can lead to, like, not only infections in your mouth, obviously, but systemic infections. So sepsis, which is, a systemic infection, usually manifesting as a bacteremia, so it's in the blood. But even as severe as endocarditis, which is an infection of the heart, which is so dangerous and requires at least 6 to 8 weeks of infusion IV antibiotics.
That's right. So, what I meant to mention as well with that bacteria culture is we're able to catch certain things preventatively before they manifest, such as Alzheimer's, such as pancreatic cancer, colorectal cancer, diabetes. All of these things actually show on the screening that we do with testing the saliva. So I always encourage patients, take this to your primary care doctor, because this is important information. And the test, it's $229, but don't you want to know if you have the precursor to pancreatic cancer and Alzheimer's? So there's two specific bacteria, and they're so long. One is called the AA, which I'm sure you know what that is, and the PG bacteria. Those two bacteria specifically are resistant to deep cleaning. So you could get your teeth cleaned once a month. If you have those two underlying bacteria, it doesn't matter how much you get your teeth cleaned. That has to be taken care of, or you are actually going to end up losing your teeth or have Alzheimer's or cancer because of that underlying bacteria. So those are the two most virulent bacteria to treat inside the mouth. And if you think about it, if we have, say, a cut, right, Dr. Lara, on our arm, and it doesn't get treated, like you said, sepsis, something, you could die, right? Mm-hmm. But for some reason, we don't think about the mouth as being like, oh, it's no big deal. So I've got pus in my gums or 7-8 millimeter pockets. That's no big deal. It's a disease. So if you have a disease in your mouth, you have systemic disease. So, that's why I'm so about prevention. Neglect is expensive, but if you can prevent the disease, if you can prevent your bone from rotting, that is so important. But I think people honestly wait until they feel a problem, which is a huge mistake in dentistry. You're never going to feel a cavity when it's in the enamel because your enamel has no feeling. Now, when it hits the nerve, then you're going to know that you have a problem. Now you're faced with, a major decision as far as what you want to do. And of course, mainstream dentistry is going to tell you need a root canal and a crown, which I would never recommend that. Or, with gum disease, you don't feel your bone rotting because your bone has no nerves, but the signs and symptoms are there. Bleeding, either when you brush or floss, sometimes a bad taste or odor in your mouth. But, people will tell me, well, my gums have always bled. That might be common, but that is not normal. Your gums should never bleed, either when you brush or floss properly. So, you have to take care of yourself. You can't expect to not go to the dentist for years, not brush your teeth, not floss, and think that you're going to be healthy. I mean, that doesn't even compute. But so many times, even when I would do demonstrations inside of health food stores, these people come in and you can tell they're really into health and fitness. And then I would ask them, so what oral care products do you use? And it's your commercial stuff. And I'm like, why are you using that? So just trying to get people to understand that, hey, if you really want to start being healthy, you need to throw out your commercial products and you need to really start taking care of your mouth. So hopefully people will take that away from listening today.
I hope so, because I feel like we're definitely throwing out some zingers there. Yeah, just because your gums bleed doesn't make it normal or healthy.
Exactly. I know. I mean, if you were to wash your hands and your cuticles started to bleed, something is wrong.
Right. So let's dive into the the toxicity of traditional dentistry's so-called solutions to our problems. So one of them being fillings. Gosh, my brain. Sorry. One of them being how they fill a cavity, and then the other being, root canals. And because I think these are other aspects that people don't realize, and I feel like I have a very superficial understanding just from my own research about how and why they're not good, and they can actually perpetuate a problem that's still there.
So nowadays we pretty much use composite resin, which is a great thing, because it used to be back in the day they would use mercury fillings, which people know them as silver, but it's really 50% weight mercury. So it's technically a mercury filling. Thankfully, that's not really used anymore, but many people, millions of Americans still have mercury fillings inside their mouth. So mercury is one of the most toxic substances known to man. I mean, back in the day, right, thermometers had mercury in it. And if one broke in a hospital, they'd have to send the hazmat team, shut down the whole floor, do the cleanup. But somehow it's safe if you stick it in your mouth, Yeah. I mean, every time you eat something hot and cold, it's releasing vapors into your body, into your bloodstream. And certainly stay away from hydrogen peroxide if you do have mercury in your mouth, because that actually leaches mercury into your bloodstream. So, I don't want people to rush to a conventional dentist and say, take out all my mercury fillings, because you're going to actually expose yourself to way more mercury doing it improperly. You need to see a mercury safe dentist. And in my book, Dentistry Made Easy, I have, protocols and stuff, and really teach people what the difference is between mercury free and a mercury safe dentist. But the mercury safe dentist is going to have HEPA filters and a rubber dam in your mouth to prevent this, more toxicity while they're drilling it out. So I would definitely encourage people to see a holistic dentist. Also, a biomimetic dentist is going to only remove the bad tooth, like the bad part of the tooth. In conventional dentistry, especially back in the day, they took too much of the tooth structure and made these big old fillings. And as time went on, they realized, that wasn't such a great idea. That weakened the tooth structure. The tooth breaks, then they end up needing a crown, and it's just like a whole Pandora's box. So I do like biomimetic dentistry, because they really use materials that are very similar to your tooth and only remove what needs to be removed instead of healthy tooth structure. So, and again, this isn't something that's going to be covered by dental insurance, but I want people to stop thinking of dental insurance as the end all be all, because dental insurance has not increased its benefits since the 1980s. But the cost of dentistry has skyrocketed. So, back then you might have been able to get quite a bit of work done for $1,500 or $2,000. But nowadays, one crown is $2,000. So that's why it can really escalate. That's why I said an easy $50,000 to $60,000 treatment plan, because I see it happen every day. And people just have no clue the cost of neglect. It's like having a vehicle and never taking it in to get an oil change or putting oil in it. You're going to blow the engine. And that's an extremely expensive repair that, had you done your maintenance on your vehicle, you wouldn't be in that position. So hopefully, I get that people don't like going to the dentist, but don't use the excuse of I don't have dental insurance or I can't afford it. You can't afford not to. It's your health. And don't let someone else dictate to you what you need to have done. You really need to be your own advocate, because you're the one that's going to have to live with the consequences. And especially with root canals, because, root canals are the standard of care. And it's honestly the only industry where you leave something dead in the body. And that doesn't even make sense. If a woman were to give birth and not get the placenta out, she would die. I mean, you cannot leave something dead in the body, but we have an entire industry, endodontics, that's all they do. So, is it worth having your health sacrificed? No, it's not. And not everybody experiences symptoms, but you don't know what your immune system can or cannot handle. So having something dead in your mouth, 100% of root canal teeth have endotoxins in there. And that is because there's a main canal, whether it be a molar tooth, which has 3 or 4 canals. Yes, an endodontist can remove those, right? but there's at least 75 different microtubules that is attached your tooth to your jawbone that cannot be accessed. So all of that infection is now being sealed inside of your jawbone. You're leaving endotoxins in there, that nasty, nasty bacteria that are really going to affect you. And in my 30 years of practicing, I can honestly tell you they fail so much of the time. Now, an endodontist will say, well, if it lasts you 8 years, it's successful. Really? 8 years? You're gonna dump how many thousands of dollars into a tooth that if you get eight years out of it, it's successful? Don't do it. You know, you could get a zirconia implant, not titanium, get a zirconia implant instead, or you can do a dental bridge. You do have options. I want people to understand you don't have to walk around like one tooth Willie. You're going to have, okay, don't freak out. There are solutions out there, but you know, I just don't want people to think, well, you know, I'm just going to get a root canal or just pull all my teeth. These are not good things to have happen.
Yeah. Wow. That's, I didn't realize it was such a short span too. Is that true for wisdom teeth removal as well? I know it's a little bit different than a root canal, but.
Well, anytime you remove a tooth, right? Think of it as like having a placenta around there. Conventional dentistry only extracts the tooth. It does not remove, let's just call it the placenta around the tooth. And so what happens is that creates a cavitation site, which is dead bone, because until that gets removed, that extra tissue gets removed, your brain does not tell your body that it's gone. So it doesn't repair it. And that's why it creates dead bone there. And so unfortunately, it can take 30, 35 years before that, you know, has a problem in your body. And that's why there's no like cause and effect right away, because it doesn't happen right away. But you do want to make sure that you have no cavitation sites. Now, wisdom teeth, I believe the meridian point is the heart. So a lot of people have heart attacks from wisdom teeth removal, from not having it done properly. But you would have to go to a holistic dentist that knows about that. That's the thing. It's like, where do you go? You know, conventional dentistry just doesn't do this. They think it's a joke. But so finding the right provider is really key, and knowing what questions to ask, which again, I try to make a resource for people so that they know what they need to ask their doctor.
And I'm just going to stay on this wisdom tooth thing for a minute, because I mean, I think so many people, almost everyone I know, had their wisdom teeth removed at one point. It almost became like the new tonsil surgery. I mean, I feel like to just, you know, take them out, it's no big deal. So are there signs and symptoms? Like, I mean, they heal normally. You didn't have any cavitations when they were healing, and you haven't had any problems since. Is there any way to like know if you're having an issue?
You know, honestly,
other than like systemic inflammation that you can't figure out what's coming from anywhere else? I
would suggest getting a cone beam of the area to make sure that there isn't a cavitation site. Sometimes there's not. I mean, the body is an amazing thing. But, you know, if you are someone that is dealing with, you know, you can't find the root cause of what's been making you sick for years, I would encourage you to go to a holistic dentist and have a cone beam of your whole jaw and see if there is something stemming from your mouth, whether it be an improper extraction or a root canal tooth or something that is creating a blockage in your body that it has to be removed for you to get better. You know, so I would just say get a cone beam x-ray of the entire jaw.
Okay. Yeah. So it would be able to be seen on films then.
It should be. Yeah. Okay. And, you know, I would say if you can keep the wisdom teeth in your mouth, like if you have enough room for them, the problem with wisdom teeth is if they're not through the gum, it's like having an ingrown hair, right? Your body is going to send cells to the area and it can create a cyst. So teeth are supposed to be through the gum tissue. So if it's semi-impacted, if it's creating an issue with the tooth in front of it, you know, you should get that removed, because you don't want infection stemming from that, because you can't keep it clean or the tooth isn't where it should be. So that would be indication to have them removed. However, if you have enough space in your jaw and you're able to keep them clean, then don't just have them removed because, hey, it's wisdom teeth, you have to have them pulled. You don't have to have them pulled unless I just, you know, stated the obvious right there.
Right. Got it. I love that. Thank you for clarifying. And then one more question, just circling back to some of the things you've said so far. So in terms of the mercury fillings, do you know or about the time where that practice changed from the mercury amalgam to the new resin? So maybe people can have a point of reference there if they need to be concerned from that perspective.
Pretty much, well, I know Europe doesn't allow it anymore. The thing is, and I hate to say this, but with our Medicaid system, because of how cheap it is, a lot of times they will still put them in our young children. Sadly,
oh my God,
it's cheaper. Yeah, I know it's all about cost and everything like that. So, but typically we don't use mercury anymore unless it's like in Medicaid or some other low income areas. But I hope they do completely phase it out because it's a huge polluter of our environment. There's that as well, what it's doing to our environment. So, but I would say they really started to phase that out more kind of in the 90s. I'd say the early 90s.
Okay. But so if you look in your mouth and you see anything silver looking, is that most likely the mercury amalgam?
Mercury, yes.
Okay.
If it's silver, it's mercury.
Okay, because the resin ones don't have a color,
nope,
correct?
They're white. They're tooth-colored. Yes.
All right, so that's an easy way to tell too,
yes.
if you're out there. So unfortunately, we can't depend on a hard cutoff, damn it.
And sadly, you're absolutely right.
All right, so where do we go from here? Are there any other things that you feel like we need to demystify or bring attention to in terms of anatomy, procedures?
Well,
like old ways of thinking.
Yes, and let's talk about fluoride because everyone has been so conditioned to believing that fluoride is wonderful and you have to have fluoride for strong teeth. And that is such a misconception. Fluoride is not an essential nutrient. There is no disease in the world where you have a fluoride deficiency because it doesn't happen. Your body does not need it. Now, your teeth are actually made out of 97% hydroxyapatite crystals. So what fluoride supposedly does is it interacts with hydroxyapatite and forms what's called fluorapatite, which is a form of hydroxyapatite. However, it's brittle. And that's why now 1 in 5 children actually have fluorosis, which is a horrible condition. The teeth look all mottled, and your teeth are the windows to your bones. So can you imagine what their bones must be like if their teeth are looking like that? So it's actually, if you look at fluorine on the periodic table, it's a halogen. Okay, you've got nerve gas from fluorine. And a lot of people are not aware that the EPA was sued last year in a court of law after years and years of battling. And it was proven that fluoride is a neurotoxin and it reduces the IQ of our children. So it's in drugs, it's in Flonase, it's in antibiotics, it's in so many different medications. And the original patent on fluoride is actually a pesticide. It's great for killing cockroaches. It's wonderful for that, but it's a mutagen. It can cause bone cancer. It can cause all these other health problems. And, I need all the brain cells that I have. I don't need them to be diminished because of the toothpaste I'm using. So, if you get a cavity, it's not from lack of fluoride. It's because either dry mouth, like breathing through your mouth, which is completely disruptive. It's unhealthy to breathe through your mouth. You need to be nasal breathing. If your pH of your saliva drops below a 5.5, which guess what? Your mouthwash, your commercial mouthwash, you know what pH it's averaging? About a 4.2.
Okay, I was going to say in the 4s maybe?
Yeah, with acid. And so, you think you're doing something good for yourself, but you're actually making things worse. You're going to make your bad breath worse. You're making your mouth more dry. I always tell people you can't poison yourself to good health. So why are you using a labeled poison? Because your toothpaste says on the back, harmful as swallowed, contact poison control. So you don't need poison to get healthy teeth. Use something bioidentical to your body, and that is nanohydroxyapatite. And I know a lot of people are like, oh, well, that'll cross the blood-brain barrier. Well, it does. Yeah, your teeth, because they contain nanohydroxyapatite, are already crossing the blood-brain barrier, so you're fine. So when you use something that contains nanohydroxyapatite, your body recognizes it and is actually beneficial to your teeth and can help prevent decay. So you do not need fluoride. And it's really just something that, disrupts your oral microbiome. If you have titanium implants, it can corrode those, which a lot of people don't know that. So, you don't need to be using these harsh chemicals to have a healthy mouth. You want to use natural organic things that are, again, going to support that mini immune system, raise the alkalinity of your mouth. Xylitol is great for that. Colloidal silver does not harm your oral microbiome. It kills only the bad bugs, not the good ones. So that's why I use colloidal silver in all of my products. So if you're giving your body what it needs, it will tend to heal itself. So if you're someone that tends to be more cavity prone, you make sure you're nasal breathing, use the right products. Give yourself vitamin D3 with K2, cod liver oil, eat healthy. I mean, you are what you eat. So I think people just need to understand that fluoride is not God's gift to the world.
Right. Well, also too, like you mentioned this too, it is in the halogen column of the periodic table, but what else is there? Our iodine is there, and our body absolutely needs iodine for a healthy functioning thyroid.
Mm-hmm.
And so if you have fluoride circulating through your system, it competes on those same receptors for the iodine, and the fluoride will bind there much stronger than the iodine and exacerbate, perpetuate, make that thyroid condition so much worse.
Absolutely.
So.
And it also calcifies our pineal gland. So, that's our spiritual connection. So, it has so many harmful effects, I should say, that would far outweigh any benefit that it has, because you can use something natural that you'll get benefits from. You don't need to have anything that contains SLS, which is the foaming action. I think people are also conditioned to, unless my toothpaste is foaming, it's not working. You don't need to use shampoo to brush your teeth.
Is that sodium lauryl sulfate?
Yes. Yeah.
Okay.
SLS. And a lot of people actually keep getting canker sores and they don't know why. And that's because a lot of times it's an allergy to SLS. So if someone is dealing with canker sores, I always ask them, well, what toothpaste are you using? And see by elimination if that helps them not develop the Aptus ulcers anymore. But, fluoride was actually the one that is in the water is the runoff from phosphate mines. And Edward Bernays was a genius when it came to marketing, because the aluminum and phosphate companies came to him and said, we need to find a way that we don't have to label this as hazardous waste. So he did this great marketing campaign of, fluoride is so good for you, we're going to put it in the water. And that's how you have fluoride in your water. So it's actually, if it was not put in the water, it would have to be labeled as hazardous waste. And it's a drug. And I don't know about you, but I don't want to be taking unnecessary drugs. I want to, be in control of that. So drugging everybody, and technically, if you look at what their argument is for putting it in the water, your teeth are done developing by the age of 6 years old. So it has absolutely no benefit for any teeth that are not developing anymore. So why are we doing this to people? It really needs to be removed out of our water supply.
Yeah. Man, I mean, in terms of that marketing piece, like the same thing was done with the oil and petroleum industry too. Like they had all of these toxic byproducts. They didn't, it was too expensive for them to dispose of them properly. So they're like, well, let's figure out other ways to use them. And here we are today, like petroleum products are in almost everything in some way, shape, or form.
Even our food.
Yeah. Lovely.
I know. And that's why, people really do need to learn how to read a label. Because it's just incredible with what they are allowed to put into our food, into our products. And if you just become more educated and understand what your skin is your largest organ and your mouth is the most vascular part of your whole body. What are you putting on your skin? What are you putting in your mouth every day that is potentially creating a problem? I mean, I think people really need to start looking at that.
Yeah. Well, because all of these membranes are porous and things move both ways. They move in through them and they move out through them. And so again, like I think a lot of this just comes down to understanding the basic biology and the function of our body, that there's this huge disconnect. Somehow this is not being taught in schools. I guess I take for granted how much science I took in school, but like how do our kids come out of even just high school not understanding that the skin is the largest organ, things go into it and come out of it, and that what you put on is absorbed systemically. That means everywhere.
Exactly. Well, and what's really frustrating too is in dentistry, really evaluating the airway and looking at the jaw and measuring the space between first molar to first molar to see if the airway is compromised. That's not taught. That's a separate certification. It's myofunctional therapy. Why is that not taught in dentistry? I was absolutely blown away that when I took my myofunctional therapy certification, what I did not know about the airway and nasal breathing. So if someone is breathing through their mouth, right, because your lungs are not designed to filter air, so it takes at least 65 days to filter the air that your nose can do in 15 minutes. And then you get no nitric oxide. You tend to overbreathe and have too much CO2 in your lungs. And guess what? We have 80% of people that have undiagnosed sleep apnea. And it's because of this, that they're not sleeping properly. They're not, their airways are compromised, and no one is even evaluating this. So understanding, proper function with the jaw, how the jaw should look. It shouldn't be long and vertical, right? It's that wide jaw that creates an open airway is super important. So for your parents that are listening, if your child has an open mouth while they're breathing, then guess what? They're probably going to have attention deficit disorder, which can lead to anxiety, depression, IBS, autoimmune problems, and eventually they're going to end up on a CPAP machine. So that's not normal. Like if your child is snoring, if they're breathing through their mouth, if they're getting a ton of cavities, those are huge red flags. You need to have them evaluated by a pediatric dentist that has gone to either the Breathe Right Institute or the Tongue Tie Academy, because those are the two places that actually know how to evaluate the airway properly.
That's so interesting. Is it in terms of adults that have this problem that haven't yet progressed to having a CPAP machine, can it be conditionally sort of retrained, like with mouth taping or something like that? I've heard a little bit about that. So
that's basically what myofunctional therapy is kind of like physical therapy for the jaw, the mouth, and the face, right? So, your tongue is a muscle. And most people have what we call improper tongue posture, where they're keeping their tongue on the floor of their mouth. So that's going to create clenching, grinding, relapsed teeth, crooked teeth. So your tongue should never be on the floor of the mouth. It should be lightly suctioned up onto the palate. But you can do a lot with myofunctional therapy and working with a therapist. Sometimes that tongue, which the fascia underneath your tongue, literally it's one piece. It's connected from your tongue all the way down to your feet. So if it is too tight, if it's too tethered to the floor of the mouth, that's where you're going to have to possibly have a tongue tie release, which is why I said you would need to go to a provider that went to one of those two schools and work with a myofunctional therapist to see what you can do about getting that tongue in the proper placement, having that tissue, if it's too tight, release so you can breathe properly. So sometimes it is functional. If it's a nasal issue, see an ENT if there's a functional reason, whether it be turbinates or a deviated septum that need to be addressed, because if it's a structural issue, you need to get that fixed as well. But that airway, it's so important. I mean, to make sure that you get oxygen. Everyone needs oxygen, so you need to be breathing properly. And a lot of times too, when I tell people take a deep breath for me, their shoulders go up. Your shoulders should not go up. That's chest breathing. Your diaphragm needs to go out. That's proper breathing, and we don't want to be breathing through our mouth. So someone who is a mouth breather and says, "Oh, I saw this thing on TikTok, I'm going to get some mouth tape," and they put the tape on, after 5 minutes they yank it off because they feel that they can't breathe. And that's because they're over breathing. They don't have the right, tools. That they need to really have some therapy, and you just can't start right off the bat with mouth tape. So you kind of have to
agreed. Yeah. Well, thank you for clarifying that too. Yeah, and it's so interesting. In terms of, I'm just thinking about to my education, and when we talk about sleep apnea, that, of course, the CPAP is the go-to solution for that. We don't teach people about proper breathing or, or send them to a proper specialist to get evaluated for these other things, but it's also so much associated with obesity. And so it's either advanced age or obesity. Well, I personally know plenty of people that are not obese, but I've been around them when they're sleeping and they're apneic.
Mm-hmm.
And so it's like, what's going on there?
What's funny, Dr. Lara, is a lot of women, especially, may not have apnea, but have something called UARS, which is upper airway resistance syndrome. So they would need a special test called a polysomnogram. A polysomnogram is going to show if there's a resistance while they're sleeping, because so many women, I talk to them and they never feel rested in the morning. They wake up a million times at night. It's probably UARS. So having the right test done is really, really key in getting to that root cause of what their issue is, because so many times they're just, women are different. We have a different functions, biochemically, everything. So
we are not just small men.
Exactly. So they might need a polysomnogram to determine whether or not they're having that issue while they sleep. Now, it doesn't always have to be a CPAP, but my first go-to is always going to be myofunctional therapy. See what you can do with how you can stretch that ligament, see how far you can go. If you're too tethered, if that is more of like a grade 3 or grade 4, that does require surgical intervention. Sometimes people don't want to do that. And I tell them, hey, we're only going to get so far with your therapy unless you go to the next step, but that's their choice. But there are appliances that are made that can hold the lower jaw forward to open up that airway as they're sleeping. But, you can't just get that appliance unless you really change your tongue posture and strengthen your muscles, because that's really just a temporary fix. And who wants to end up on a CPAP machine? I mean, that's really no fun. So hopefully we can educate people and say, look, really look into some myofunctional therapy, possibly might need a tongue tie release, and go from there, as opposed to being a prisoner to a CPAP machine the rest of their life.
Yeah, I just feel it's one of those things that's become so normalized.
Yep.
And, because of the lack of awareness of these other options, I can totally see why. But yeah, and the other option is, if you're not getting the proper amount of oxygen when you're sleeping, your brain cells are dying. This is nothing, again, it's nothing to sneeze at. Exactly. The consequences are earlier onset dementia of some form, or Alzheimer's if you're, genetically predisposed. And again, we talk about lifespan. And so as soon as that cognitive decline starts happening, your lifespan follows with, in terms of shortening. So it's a big deal, guys. So please pay attention to and take it seriously and do the investigation, figure out what's best for you. We're not here to tell you, what to do and what not to do per se, but we definitely are here to try to give you all the options and the healthiest ones if we can.
Absolutely. I'm always a big proponent of telling people, hey, don't even listen to me. Go and do your own research, because I really want people to feel comfortable with whatever decision that they've made. Because like I said, it's your body. You're the one that has to live with the consequences. So, but be informed. Don't just do something blindly because, my dentist told me I needed this. Do your research on it first. And like I said, so many times oh gosh, I'd be such a wealthy woman if I had $1 for every time I've heard some of these things. But hopefully people will really start to wake up and take their oral health more seriously. And it's not just your teeth. I mean, yes, we can amputate, we can make prosthetic limbs, but is it ever the same? It's not. You don't talk the same, you don't look the same, and especially women. I mean, it really just ages you so much. So, we don't want to just be doing that. We want to keep what you have as much as possible. And I get it. Sometimes there are cases where, you're gonna lose some. Maybe they're root canal teeth, and you're at that point where you're ready to make that next step and have those removed, and maybe look at some zirconia implants, hopefully. But I really hope people will make that next step and go to the dentist if they haven't been in a long time.
Yeah.
Watch my videos on how to do things properly, because, people will say, oh, I floss. And then I hand them a piece of floss and they don't know what the heck they're doing because they think using those little cheaters are doing the job. And this is how I describe it. Plaque is part of our saliva, right? Our teeth poop. Every single day, your teeth poop. They're excreting, right? So brushing gets off 60% of that poop, but the rest is in the toilet bowl, and that is the space between your tooth and your gum. So those little cheater flosses do not clean out the bowl, okay? They clean maybe 1 to 2 millimeters in between the teeth, but they do not go down to the base of the bowl, which is why you need to be using manual floss, which will only go down to 4 millimeters, and you need to do it properly. But if you have gum disease, you really have to get a water pick because that's really the only way to access pockets that are deeper than 4. So if you have active infection in your mouth, and we take a little ruler and we're measuring that space, that toilet bowl there, it should be a 1, 2, or a 3. 4 is like gingivitis. 5 is the beginning of periodontal disease. 6 is 7, 8. Those are all really bad. So we want to close that space. We don't want bacteria breeding in that bowl. We want nice, tight, healthy tissue. That's why we don't want bleeding. So, using proper manual floss, using a good electric toothbrush, those are all very, very important things. And the first thing that people should do, because your teeth do poop, is in the morning, as soon as you wake up, go and scrape your tongue and brush your teeth before you do anything else. And I know people have been conditioned to brush their teeth after they eat, but don't do that because your teeth are actually trying to remineralize after you eat. So for the first 30 minutes, you want to wait and let your saliva do its job. Then you can brush your teeth, but don't disrupt that remineralization process. You'll make your teeth more soft and weak by interfering.
Okay, that's good to know. I didn't, one more thing I learned today. Yay. So I do actually have a question before we're sort of getting near to the end, but not quite yet. So I'm going to ask, what about oil pulling? Because
I love it. Yeah.
Okay, good.
It's an Ayurvedic thing that's been around for centuries. And I actually have the only toothpaste on the market that also doubles as an oil pull because the main ingredient in my toothpaste is coconut oil, which is the best oil to use. So what the oil pulling does is it pulls the toxins from your whole mouth. It does take about 15 minutes, sometimes 20, between 15 and 20 minutes to really get those toxins worked out. And you do not swallow that. You have to spit that out because that's got all kinds of bacteria in there. So you kind of pull it through your teeth. And the great thing with coconut oil is that it's naturally anti-inflammatory. It naturally whitens your teeth. It's just a really great oil to use to help, kill that bad bacteria. And again, helps the oral microbiome stay balanced. So I do love oil pulling, even if you do it just 2 to 3 times a week. It's not something that you necessarily have to do every single day, but it is just another good thing to have in your toolkit as far as, supporting your oral health. I tell people keep your floss in the shower. So hopefully it's not out of sight, out of mind. You can, I'm basically asking for maybe 6 minutes a day. 2 minutes to brush properly with an electric toothbrush, a minute to floss. It's not a lot of time that it takes to have good oral health, but it's something you have to make a priority.
Yeah, so I do oil pull, and so what I do is I'll put a little bit in and then start swishing, and then I'll go do I'll make the dog foods, for the day, or whatever, something that I know that's going to take me about 10 to 15 minutes.
Yeah,
and just also for people out there, you don't need a lot to start with because your own saliva will sort of fill in with volume, and so by the time you're done, you have a full mouth of squish to spit out.
So true. Exactly. A little goes a long way.
Yeah. When I first started, I would start with what I normally would for a mouthwash. And then finally I'm like, oh my gosh, this is too much. So I sort of had to by default learn that a little goes a long way. So.
Very true. Yeah.
And again, you don't have to buy a fancy oil pulling thing from the health food store. You can just do it with just a little bit of coconut oil. It's totally fine and just as good.
Or use my toothpaste.
Or use the toothpaste for sure, which I do love because you're getting that silver in there as well.
Yeah, and xylitol and nanohydroxyapatite. So, it's just all the ingredients I use are super expensive, but I've really wanted the high quality stuff because it's just, it's so important to be using raw ingredients. That's the other thing I don't do in my toothpaste is I don't cook it. It's not heated past 117 degrees. So all of the ingredients are considered raw. So, and my toothpaste is also vegan for people that are vegan.
Cool. Man, have we not touched on anything else that you feel like we need to bring some attention and light to?
I think we have pretty much hit all of the main ones. I know people can feel a little overwhelmed, but I always try and tell them just make one small change at a time. I think we tend to say, oh, I got to go into my pantry. I got to throw everything away. I got to, throw out every single skin lotion and everything that I have. Make one small change at a time so it doesn't feel overwhelming, but just take that next step and, call your dentist, get on track. Like I said, I have a YouTube channel so you can kind of educate yourself. I have books out there. If you're somebody that, you kind of don't know where to start, get the Dentistry Made Easy. It's so informative. It's a handbook for everybody out there. So you feel like you have the right questions to ask. And I think that helps take away some of the fear and anxiety because so many people are just fearful. And I hate to see that, but you do need to find the right provider for sure.
Yeah. So tell everyone where they can find you.
So you can go to my website, simplysilvermouthwash.com. You can also, I have a separate website with all of my myofunctional therapy stuff on there, but you can get to that website through Simply Silver Mouthwash. I'm also a consultant. If you want to just consult with me, you can book an appointment. It's $50. It's not a lot of money for a consultation. You can get my books on Amazon as well. So if they want to reach out to me directly, my email is heather@simplysilvermouthwash.com.
Beautiful. And are your products, are they stocked in like Whole Foods or Sprouts or places, or are they mainly on Amazon?
So, Whole Foods won't allow Colloidal Silver in their store, if you can believe that. So because I have Colloidal Silver, you'll never find me in Whole Foods, sadly. I'm in HEB Healthy Living section in the Texas area, but Amazon or my website. Okay. If you sign up on my website to become an email subscriber, I offer monthly discounts. So you can, I'll always sell cheapest on my website, but Amazon is another very convenient, or Walmart as well.
Oh, okay. Yeah. I mean, that's a huge one for people
in
terms
of access. Yeah. Walmart online, not in the store.
Yeah. Okay. Awesome. Well, thank you so much. This has been, I feel like, really powerful and enlightening and helpful. I've definitely learned a lot. So, yay. I super appreciate you and all the work that you're doing.
Well, thank you so much for this time.
Yeah, you're so welcome. So all of our listeners out there, make sure you check out simplysilvermouthwash.com. And also your YouTube channel, is it?
Mouthwash.
It's also the same. Perfect. Beautiful. All right. Well, yeah, if you guys have any questions, please feel free to reach out to Heather directly, or you can email me and then I can pass on your question to her. You are always welcome to leave comments and questions on the socials. And we are here really to just disseminate good information and to help you have the tools so you can make the right choices for you. Absolutely. So, yeah. So until next time, everybody, stay healthy and stay empowered and in the know. Thank you for joining me on Light Body Radio, where functional medicine meets intuitive healing and transformation happens on every level. If this episode resonated with you, please like, share, and if you're ready to go deeper, visit drlaramay.com to book a functional medicine consultation or an intuitive healing session. Whether you need to rebalance your body, clear your energetic blocks, or reconnect with your soul's purpose, I've got you. You can also follow me on Instagram or TikTok at Dr. Lara May for daily inspiration, energy updates, and healing tools. Remember,
Your healing is multidimensional, and so are you. Until next time, honor your body, trust your intuition, and activate your light.